As Dr. John LaPook mentioned, there is new guidance this morning from the CDC about how the coronavirus can spread. Our lead national correspondent, David Begnaud, joins us. David, this is the third change in less than a month. What does the new guidance say?
Right, Anthony. So the CDC is now confirming, yet again, that it's airborne. It can travel through the air in tiny particles more than 6 feet. Less than a month ago, they posted it on their website, but they removed it. And infectious disease experts around the country said, wait a minute, why did you remove it? Are you caving to pressure? That is, in fact, the science. So now the CDC's got it back on their website.
It's not a surprise to any of us. We've known for months that aerosols played an important role in the transmission.
He is Dr. Michael Osterholm, an infectious disease expert at the University of Minnesota. He says the CDC's updated guidance on how coronavirus spreads is finally starting to reflect the science. What essentially are they acknowledging now?
The CDC is finally acknowledging that these very tiny particles that can float long distances and hang in the air for hours are actually part of the transmission of this virus from an infected individual to someone who's not yet infected. That has tremendous implications.
The guidance now on the CDC's website specifically states that the virus may be able to infect people who are further than 6 feet away, especially within enclosed spaces that had inadequate ventilation, and if someone is breathing heavily while singing or exercising. There is a report from the New York Times that says scientists at the FDA are being blocked by the White House from implementing strict new federal guidelines for the emergency release of the vaccine. Those enhanced safety guidelines would almost guarantee no vaccine would be approved before the November election.
The FDA has good reasons for doing what they're doing. They have career scientists who develop these kind of models of what you need to do to assure safety and to assure efficacy. And right now, this is what they said, and we'll see what happens.
Back here in New York City, we are in Queens because yesterday, you might remember, we told you that the mayor wanted to shut down schools and non-essential businesses like restaurants in 9 zip codes in Queens and Brooklyn. Well, the governor has weighed in because the governor has to approve it. The governor says you can shut down the schools because the cases are spiking here, but I don't want you shutting down restaurants and non-essential businesses yet. The governor says he needs more information before he approves that. Tony?
All right, David, thank you very much. You know, before we move on, guys, we've been talking about the politics of the reaction, the president's comments and the politics of the virus, but there's also the reality of the virus, and I just jotted down a few numbers here. We're looking at 210,000 people dead in this country. Many of them died alone. In fact, most of them did. Yep. 11 million jobs lost. That is net. That is not the total loss. That is gone. Those jobs are eliminated. And 41 million kids this morning, right now as we speak, are preparing for another day of learning at home. Yeah. So when we talk about the impact of this virus, these people are not afraid of it. They're not being dominated by it. They're living with it.
Exactly. Yes, and it's still raging. I like Amanda Klutz. You know, we covered her story with her husband who ultimately lost his life after 95 days. She says, unfortunately, it did dominate our lives, didn't it? It is something to be afraid of. After you see the person you love the most die from the disease, you would never say what his tweet said. It is sad, it is hurtful, it is disgraceful. Yeah. So while people are glad that he's recovering, we're glad that he's recovering, you're still very angry that it seems to be very cavalier.
But in this moment, he seemed to be declaring victory before this fight is over.
That he's still fighting.
Exactly. As John LaPook pointed out, in many patients, you see a resurgence a week or so later down the line. And as we've also learned from many people who've been through this and thought they had come out the other side, months later, they can have lingering after effects that in many cases still haven't really been explained. There's, as we keep pointing out, there is so much we still don't know about this virus.
But at least right now, please pay attention to the science. The mask wearing is so important.